Hi, and welcome to the video on how to complete your Miralax bowel preparation prior to your colonoscopy at Gastroenterology Associates. It may help to have your printed out instructions from the office to review while watching this video. Please remember to follow all instructions. Failure to do so may result in delays or cancellations. As a reminder, an adult driver 18 years or older must accompany you and remain in the facility during your procedure. Please ensure to double check your appointment information to confirm date, time, and arrival time. You may need to refrain from taking any blood thinning medication prior to your procedure. Please call the office if you take a blood thinner and have not received instructions. 7 days prior to your procedure, stop taking any medications such as Adipex, Lomira, Qsymia, phentermine, or Golo release. 5 days prior to your procedure, stop taking any iron supplements. 3 days prior to your procedure, stop eating seeds, nuts, corn, and popcorn. 1 day prior to your procedure, you must follow a clear liquid diet. You will not be allowed any solid foods for the entire day of your bowel prep. If you are a diabetic, you may take half the dose of your diabetic medication or insulin on your bowel prep day. On the day of the procedure, you may take aspirin, blood pressure or heart medications, as well as thyroid or seizure medications with a small sip of water. It is encouraged that you take these as normal if prescribed by your doctor. Your bowel prep will begin on the day prior to your procedure. You will consume a clear liquid diet and will not be allowed any solid food on this day. To complete your Miralax bowel prep, you will need 238-gram bottle of Miralax, 4 Dulcolax laxative tablets, 64 ounces of Gatorade. Please refrain from drinking any red, blue, or purple Gatorade or other clear liquids. You can buy all of these materials over the counter at your local pharmacy. At 5 p.m., take 4 Dulcolax tablets with 8 ounces of clear liquid. At 6 p.m., mix all of the Miralax with the 64 ounces of Gatorade. Drink 8 ounces every 30 minutes for a total of 4 doses. Then, at the second half of your prep time, drink 8 ounces of the remaining solution every 30 minutes for a total of 4 doses. Please see the chart on the screen to know when to begin the second half of your bowel prep. After completing your bowel prep, your stool should be a liquid consistency. Your stool should be clear or clear yellow. Please see the diagram on the screen for what your stool should look like. If your stool appears dark, murky, or solid after completing the prep, please call the office for further instructions. You may not have anything by mouth in the 4 hours prior to the procedure. This includes no water, gum, or hard candy. You may have clear liquids until then. Remember, no solid foods are allowed the day prior to the procedure. And as a reminder, please follow these instructions correctly to avoid cancellation related to anesthesia risks. Now, you may be wondering, what does a clear liquid diet mean? Clear liquids are liquids you can see through at room temperature. If you can't see through it, you can't have it. Here are some examples of what constitutes a clear liquid diet. Soups, such as bouillon. Please refrain from actual broth due to the fat content in this liquid. Desserts, such as Jell-O, dairy, and fruit-free popsicles. Beverages, such as black coffee with sugar. Please refrain from putting any dairy or artificial creamers in the coffee as these are not considered clear liquids. You may also have tea, apple juice, white grape juice, Coke, Pepsi, 7-Up, Sprite, ginger ale, Gatorade, G2, and Powerade. Do not drink alcohol, dairy products, or cloudy juices such as orange or pineapple juice. Do not consume any red, blue, or purple liquids. Again, do not eat any solid foods. Dizziness or headache can be signs of low blood sugar. A regular soda or apple juice may alleviate these symptoms. You will be receiving sedation during your procedure. Sedation impairs your normal protective reflexes. Having food or liquids in your stomach of any amount can cause choking or vomiting and greatly increases the chance of serious consequences. Please strictly follow all guidelines. Procedure cancellation policy. Cancellations less than 7 days prior to your procedure will result in a $100 fee. No showing your procedure will result in a $250 fee. Appointments rescheduled more than 2 times will result in a $100 fee, and an office visit will be required prior to rescheduling again. Now, you may still have some unanswered questions. Let's go over some frequently asked questions. Can you have your procedure if you have had an upper respiratory infection? You will need to be symptom-free for at least 4 weeks prior to your procedure. Please call the office if you need to reschedule. What happens if you start to feel nauseated or start to vomit? You should wait 15 to 30 minutes before continuing the prep and then start back slowly. You may take Benadryl to help control any nausea. Refrigerating and drinking your prep through a straw may also help. Do you still need to take the entire prep if you already have loose, watery stools? Yes, you must complete the entire prep. You may have solid stool higher in the colon that needs to be eliminated. Do you still have to take the laxative if you already have diarrhea? Yes, you must take the prep as directed by your doctor. Your colon is approximately 6 feet long. The entire colon must be emptied for your physician to see the colon clearly. Can you still take your medication even if the pill is red? Medications for blood pressure, thyroid, heart conditions, and seizure should be taken the morning of your procedure regardless of the color. Can you have a colonoscopy on your menstrual period? Yes, the procedure can still be performed. We ask that you use a tampon if possible, or we can place a bedpan if a tampon is not an option for you. Is there any way that you can make the prep taste any better? You can try sucking on hard candy, but nothing with a soft center or red, blue, or purple color. You can rinse your mouth with water or mouthwash. Do not eat or drink anything other than approved liquids while you are drinking the solution. What can you do if your bottom is sore? You can clean the area by avoiding rubbing and gently pat with a wet washcloth. Liberally apply Vaseline, Preparation H, or Desitin. What should you do if you see yellow color with a few flecks in the toilet? If your bowel movements were clear enough that you are able to see the bottom of the toilet, you should be fine. It is okay if you have some flecks of material. The yellow color is a result of bile that normally colors the feces. This should not interfere with the examination. What should you do if you are still passing stool the morning of the procedure? You should take a tap water enema until you run clear. If this does not work, call the office. Is it okay for you to drink Gatorade if you're a diabetic? It is okay to drink Gatorade, but you may substitute with Gatorade G2 or Powerade Zero. Can you drink something other than Gatorade for your bowel prep? You may use other clear sports drinks. We encourage you to hydrate and get in electrolytes since you are not eating solid foods. What is bouillon? When we say to use bouillon and not broth, we are referring to powder or cubes in hot water. Other forms of broth can contain fat content and can cause poor cleanout from the prep. For any other questions or concerns regarding your bowel prep, please reach out to the office at 864-232-7338. Thank you so much for watching.